Well, we are in discussion with Secretary Galvez and the National Task Force. And actually, you have three choices. Number one, to be rigid about it, is another extension, which is about 15 days. Because we have the same problem as the United States. In the United States, they had the lockdown one day after President Duterte issued the lockdown, or the ECQ. So that is the main problem also in the United States. The second choice is whether you have a phase down or a rolling opening or restarting of the economy, right? So you have the two choices. And then number three, just status quo. So the recommendation for a win-win situation, because we think that the economy will not endure so much extension, is for a rolling or a phasing or a localized opening of the economy, but based on two metrics. One is epidemiological, which is actually medical, and the other one is the healthcare capacity. Now, on the first one, you need to understand the number of cases, if there are more cases, if there are more deaths, if there are less recoveries. These are the metrics of success. If the doubling time is actually short, that's important. The other important thing is the healthcare capacity. Healthcare capacity. Do you have the testing centers with you? Do you have the testing kits with you in that locality? You have the human resources with you? Do you have the funding for that? Do you have the COVID hospitals ready? Or without COVID hospitals, do you have an isolated area in the hospital with human resources to address this? Now, if you don't have that, then you might be on a rolling reopening. So, for example, the first one to have a major change is, let's say, Valenzuela. So they have everything already. They have the testing already. And then I think Pasig City, Vico, and then I think Governor John Vic Remulla. So the readiness and the preparedness of the locality. But essentially, the priority should be on essential workers. And the definition of the essential workers will be the healthcare, executive governance, banking, communication infrastructure, security, electricity, basic food, water, sanitation services, transportation. So, meaning to say, not all will be, allowed on the streets because of social distancing. While you maintain social distancing, the cough etiquette, and the hygienic measures, you have to reevaluate after, let's say, 1 week or 2 weeks, depending on the data that will be coming from the Department of Health. If there is a second wave, then you can actually, like in Singapore or Taiwan, Singapore issued a lockdown from April 7 to May 4. Because when they relax, nagkaroon ng relapse or second wave because of the incoming OFW, traced to dormitories of the OFW. So, we have some models in the United States and in Singapore and other countries. In the USA, I was able to view the situation there. They interview usually a governor, the academe, or the health sector, and then all of them would say the health condition would actually be the priority over the economy. But you have to wait. They are not in our situation right now when we have launched already the testing kits and we have many quarantine areas. In the United States, they are not prepared. So they are actually on their peak, going into their peak right now. I think with the ECQ, though it is not shown right now, the epidemiological curve,
Yeah.
I think we are plateauing or going down, because I look at the world, John Hopkins University. I usually peep on the website, and we are like this. We are on the peak, going down.
That's good news. That's good news. That's
On a day-to-day basis, I look at it because there's a website where you can see all all the countries, and we are on this. And of course, with the backlog coming from the RITM and the DOH, we could not put the granular data. But my model is, of course, the John Hopkins, which is actually the world's monitor, the world beater. We are actually on that. So I'm looking at that, and I'm positive that the ECQ has made an effect. And then we have already the testing kits, like in South Korea. We have isolation. We have the infrastructure ready. The PPEs are coming. I think we're ready. And therefore, we need to decide. But you need to decide right away so that on April 30, the people are ready. You cannot just announce it on April 30. There must be preparation for the local government unit and which local government unit you're going to open based on their performance level. Based on health measures, that is the viral spread. Number two, based on their healthcare infrastructure capacity.
Okay. Wow, this is very good. Thank you for all this detail, Dr. Tony Leachon. So let's start first with some of the industries that you've mentioned.